Hi, my name is Hanna Saba. I'm a medical oncologist. I joined Cancer Care Specialist of Illinois in 2007. I practiced my medicine and served patients in Effingham area as well as my satellite clinics in Olney. I graduated from Damascus University in 1989, had a different variety of clinical practices and training programs and residencies, including military, and I finished internal medicine training from Cook County Hospital in Illinois, and then finished my hematology oncology fellowship training from Michigan State University in Lansing, Michigan. Chemotherapy traditionally and historically had a bad reputation that made people really sick. Things have changed tremendously for the last, I would say, couple of decades, and treatment with chemotherapy has improved a lot, and most people will take it in much better, and many of them actually may continue near normal life with it, especially that we still call most of our treatment for cancer chemotherapy just because we're familiar with the term and patient familiar with the term, even though many patients may actually be taking their cancer treatment that does not include any really chemotherapy. Most of the treatments are newer targeted agents that has very little side effects or toxicity. So things has changed. They would expect some side effects, no question about it, but everybody is different and every cancer is different, and chemotherapy is not the same and may vary a lot from one disease to another and from one patient to another. So the best thing is just to ask the questions, know exactly what patients take in. We have a good education for patients and family before they start their chemotherapy, and we specifically teach them about the drugs and possible toxicity and when they do. And more importantly, we're always available for patients 24/7 to call with any problem that they have. Well, the important thing for me is make patient know upfront that we are all team in one front against one enemy, which is the cancer. The patient, his family, and me, as well as the whole staff. And it's important that patients should be familiar and have good knowledge of their cancer. I do not like to be the one who's just making all the decision and telling patients, we're gonna do this, we're gonna do that. I prefer that patients understand exactly every single step we're doing, why and how, and many times they take part in that decisions. And that usually can give better and more success in the treatment of cancer and better journey during the cancer treatment. Cancer treatment has changed tremendously for the last not only like few decades, just the last decade or so, to the point that actually most of the treatment I use now, I wasn't even using it like 10 years ago. Mainly the main things is the opening up of a new era of targeted therapy and immunotherapy. After a long period of kind of roadblocks where we didn't make much improvement in the treatment of the chemotherapy, after chemotherapy and radiation, there was like a couple of decades where there was very little improvement until the area of targeted therapy like opened up. When we study individual cancer, see what's driving this cancer and making it malignant and grow, and try to target that specific area in that cancer itself. So treatment in general has become more individualized, more specific for cancer specification, and much less toxic as well. Well, research and clinical trials are extremely important in cancer treatment. I mean, they are crucial. Basically, all what I have said about the progress in treatment for cancer, making it better, making it more successful, opening up a new era of different types of therapy, all came through research and clinical trials. So what I treat my patients with today. Today's standard of care is yesterday's clinical trial. And without research and study, we will never get better and better. This is the way we improve our treatment in cancer. Clinical trial, just I said, is a study that answers a question. And this question could be, is a new drug better than an old one? Or adding a new drug to an old treatment is better? Or giving an old treatment in a different way is better? And this is, as I said, how we improve our treatment and make it better and better. So participating in clinical trials is a crucial part in continuing improving our treatments in cancer. Well, practice of medicine and oncology in general is definitely tough and stressful and exhausting, and we as doctors, we need those moments that keeps us going, and rewarding moments that will keep us going. And these are usually, to me, when I feel that I was able to make a difference in someone's life. Not necessarily saving somebody's life, but just making a difference, make his life easier, or make his terminal illness easier and more peaceful. And if I want to think about certain moment like this, is the time when you feel like you are in a position where you have to make a decision and you have to use all your study, all your knowledge, all your experience, and summarize it in one moment where you have to make a decision and you hope that it is the right one. If I have to pick one, I would remember about 10 years ago, one of my patients was in the ICU, very sick, intubated, heart and lung failures, and she was diagnosed with a very aggressive form of lymphoma, and it was the main reason that she was this sick. And of course, there was a lot of thought of just pulling the plug and let her go in peace, and no one would have really fault anybody to do that. But then that moment hit me when I felt this woman really never had the chance. She was never treated for this, and this is a relatively treatable and possibly curable disease. So I made a decision to treat her then chemotherapy in the ICU when she's intubated. And that's not something common that we do every day. I've never done it before, I never done it after. But long story short, it was the right decisions, and 2 days later she was more stable. A week later extubated. 3 weeks later she was in my clinic, and 6 months later she was cancer free. And now every time she walks into my clinic, every 6 months, 10 years after her initial diagnosis, I just cannot help myself from smiling, remembering that moment.